So the thyroid hormone is the largest endocrine organ, and it is present anterolaterally, meaning towards the anterior as well as slightly towards the lateral sides. So it's kind of wraps around the trachea, but it does not go all the way around the trachea. So the gland itself is located in between C5 to T1 vertebrae, and the hormone secreted by the thyroid glands is called thyroxine. And when we are in need of thyroxine, the hypothalamus sends a signal to the anterior pituitary lobe. The anterior pituitary lobe secretes thyroxine stimulating hormone, and the thyroxine stimulating hormone in turn stimulates the thyroid glands to secrete thyroxine, which is just a fancy name for thyroid hormone. So the thyroid gland consists of two lateral lobes, one to the right and the other one to the left, and in between the two it contains a region known as the isthmus. The isthmus connects both sides, the left and right, and some major arteries that supply blood to the thyroid gland include the superior thyroid artery, and the superior thyroid artery branches off from the carotid artery because the thyroid gland is very close to the aorta actually. So the carotid artery branches off to form a superior carotid artery, and it has the superior thyroid artery, and it also has the inferior thyroid artery, which branches off the subclavian artery. So the fact that the thyroid gland has a lot of blood supply and is really close to the aorta and right from the heart, it's one of the regions that gets a lot of supply of blood. That is because one of the major function of the thyroid gland is to increase the metabolism of the body. And that is called BMR. BMR stands for basal metabolic rate. Basal metabolic rate is basically the metabolism that we perform at rest, the energy that we produce at the state of rest. Okay, so I'm going to write this down real quick. Basal metabolic rate is BMR. So the thyroid glands consist of follicles that produce a glycoprotein known as thyroglobulin, which you'll look at in just a second. Thyroglobulin is basically the precursor for thyroid hormones. If you take a look at the thyroid tissue, this whole is one thyroid follicle. This is a single thyroid follicle. This is a single thyroid follicle. Well, this is a single thyroid follicle. That's not a thyroid follicle. That's a parafollicular cell. Now, inside the thyroid follicle, you have something called as thyroglobulin. Thyroglobulin are the precursors for thyroid hormones. There are two types of thyroid hormone, T3 and T4 thyroid hormone. And then you have the parafollicular cells surrounding the thyroid follicle, and these parafollicular cells produce a hormone known as calcitonin. Now, calcitonin is the hormone that stimulates osteoblast activity, meaning it helps in building bones. So it promotes bone formation. So while it promotes bone formation, it utilizes the calcium in blood. So the main role of calcitonin is to reduce blood calcium. So it lowers blood calcium. So if you take a look at the anatomy of the thyroid gland, well, you see the trachea over here, that's the trachea, and that's the isthmus, and that's the lateral lobes of the thyroid gland. And there you have the trachea, and right over here you see the aorta. Okay. So you can see how close the thyroid gland is to the aorta. And right over here you see the thyroid gland, so it's right above the clavicular bone. So this is a very important region in the body, because while performing tracheostomy, it's not just easy to poke a hole and insert a pipe in there, because you're going to damage the thyroid gland. So it's very important to remember that it's right above the clavicle of the neck. So the two types of thyroid hormones are triiodothyronine and thyroxine. These are the two forms. Now these two hormones are secreted when thyroid stimulating hormone is secreted from the anterior pituitary. So the thyroid stimulating hormone acts upon the thyroid gland, and the thyroid glands secrete T3 and T4 thyroid hormones. Now, when the level of TSH, that is thyroid stimulating hormone, increases, the thyroid follicles enlarge in size. So every time the TSH is released, the thyroid follicles grow in size, and it's filled with thyroglobulin, which is the precursor to the thyroid hormones. So the major difference between T3 and T4 is the number of iodine molecules they contain in the chemical structure. T3 contains 3 iodine molecules. T4 contains 4 iodine molecules. So if you look at the chemical structure of the thyroid hormone, they are very closely related, but they have different number of iodine attached to the structure. So right over here is T3 and this is T4. You can see it has 1, 2, 3, 4 iodine molecule. So from the structure, you'd be able to understand that iodine is important for proper synthesis of thyroid hormones. And for this reason, when you eat salt, you basically have iodized salt. If you read the bottle, it says iodized salt. We need up to about 50 milligram of iodine per week, which is not a large amount. But if there's not enough iodine in food, we don't synthesize proper thyroid hormones, which are functionally active. So the thyroid stimulating hormone constantly gets released from the anterior pituitary. When TSH gets released from the anterior pituitary, the thyroid follicles grow in size, and that's why it leads to goiter. Because the anterior pituitary does not know that we don't have enough iodine in our food, and it constantly keeps stimulating the thyroid glands, which leads to goiter. So one of the major functions of the thyroid hormone is to increase the basal metabolic rate. Basal metabolic rate, or BMR, is the amount of energy that we synthesize, that we produce or at rest. And it plays a major role in blood pressure, and it plays a major role in growth of tissue, skeletal system, and development of nervous system. So as you know, that people who have thyroid problems usually end up having infertility problems or reproductive problems. That is due to the effects of thyroid hormone on the growth and development of several different tissues in the body. The thyroid hormone not only affects, just the reproductive organs, it affects absolutely every organ in the body. And that's why people with hypothyroidism, they have a lower body temperature and they tend to gain weight because of poor metabolism in the body. So this picture shows the regulation of thyroid hormone. So when a person undergoes thyroidectomy, that is removal of the thyroid gland, it leads to hypothyroidism. So when thyroidectomy is performed, the levels of T3 and T4 drop in the blood. And when there are low levels of T3 and T4, the hypothalamus first releases thyroid releasing hormone, and the thyroid releasing hormone stimulates the anterior pituitary cells to secrete thyroid stimulating hormone. Now, once the thyroid stimulating hormone dissolves in blood and reaches the thyroid gland synthesizes T3 and T4 thyroid hormones by the follicular cell. And by doing this, it elevates the levels of T3 and T4 in the body. Now, the way feedback mechanism occurs is also by the presence elevated levels of T3 in the body. So when we have too much T3 in the body, the anterior pituitary gland gets inhibited, and it also inhibits the thyroid releasing hormones in the hypothalamus. Okay. So T3 triiodothyronine is secreted in lesser amounts in the blood, whereas T4 is secreted in a larger amount. However, the T3 form is more potent than the T4 form. Now, when the thyroid hormone is deficient in the body, that it can be due to a problem in the hypothalamus, or it can be a problem due to the pituitary gland, or it can be a problem in the thyroid gland. If the problem due to poor secretion is in the thyroid gland itself, it's called a primary disorder. If there's a problem in the pituitary gland, it's called a secondary disorder. And if there's a problem with the hypothalamus, it's called a tertiary disorder. So hypo means low. So hyposecretion means that the person is not secreting enough thyroid gland. Now, if this condition is in newborns and babies, it leads to cretinism. Now, this is a medical emergency. So all newborns are evaluated for their thyroid activity when they are born, and this is preventable with medication and hormone replacement because thyroid hormones largely affect cellular respiration, heat production, metabolism, growth and development of the body. So when a baby does not have enough thyroid hormones, it leads to severe mental retardation, and that condition and birth defects, and this condition is known as cretinism. In adults, this condition can lead to a condition known as Hashimoto's disease, or you can simply call it hypothyroidism. Now, the difference between hypothyroidism and Hashimoto's disease is that Hashimoto's is an autoimmune disease that damages the thyroid gland, whereas hypothyroidism can simply be due to an underactive thyroid, and it not necessarily need be so due to the immune system. And hypersecretion leads to a condition known as Graves' disease. So Graves' disease is due to an overactive thyroid. A peculiar characteristic or a symptom of Graves' disease is bulging out eyes. So this is known as exophthalmos. It's also called Graves' ophthalmopathy. And a person with Graves' disease is anxious and irritable. Their hands or fingers, you might see fine tremors. They show excessive weight loss, and they have abnormal eating habits. Weight loss because the body becomes overly metabolic, so you just burn everything you eat. So they become really hungry, and they show excessive weight loss. You also observe a rapid or irregular heartbeat in case of hyperthyroidism. This condition also leads to changes in the skin. So it leads to redness in the skin. A lot of times you see the changes on the shins or top of the feet. So in men, it also leads to erectile dysfunction or a reduced libido. So this picture shows Graves' disease, but this picture over here shows hypothyroidism, and you can see that the neck has a presence of an enlarged gland. This is due to excessive secretion of thyroid stimulating hormone when the thyroid gland itself is unable to produce a proper thyroid hormone. So one of the first symptoms of hypothyroidism is that the body temperature drops because the metabolism drops and we don't produce enough heat. And bradycardia is another symptom of hypothyroidism. But goiter is a disease when you don't have enough salt in your food, which can lead to malformed, thyroid hormones. So you don't have the iodine that's needed for proper functioning of thyroid hormone. And this is a symptom in hypothyroidism in general. So the other glands that are present behind the thyroid glands are called parathyroid glands. The parathyroid glands are pea-sized glands behind the thyroid gland. So you have 4 glands partially embedded in the thyroid gland, and the main role of parathyroid gland is to increase blood calcium levels. So they are the opposite of what calcitonin does. Okay, calcitonin helps in reducing blood calcium, whereas parathyroid gland increases blood calcium. So they promote osteoclast activity, and they break down or dissolve or absorb the bones to release calcium back into the bloodstream. So this over here is a picture of the thyroid gland right behind here. That's the parathyroid gland. This is called the pyramidal lobe of the thyroid gland, which is present right above the isthmus. Now this picture shows the regulation of calcium in the blood. So the main hormones that are involved in calcium regulation are parathyroid hormones and also calcitonin. Now, when the level of calcium in the blood is really high, the thyroid gland is stimulated to release calcitonin from the parathyroid follicles. Calcitonin inhibits osteoclast activity and stimulates osteoblast activity. The osteoblasts take up blood calcium and then deposit them on the bone, so the blood calcium level gets lowered. When the blood calcium level is too low, the parathyroid gland gets activated. The parathyroid gland secrete parathyroid hormone, and the parathyroid hormone increase osteoclast activity. So the osteoclasts basically dissolve the bony tissue and they release calcium back into the blood. So along with osteoclast activity, parathyroid hormone also increase the activity of calcitriol or D3. So the calcitriol increases the absorption of calcium from food, which also leads to increase in blood calcium.